am tremendously grateful that Amy is joining us, and I want to invite her up because Cover Oregon is not only doing a lot, but they have a lot of eyes on them. So getting it right is really important. And we'll hear from Amy, we'll hear from Cover Oregon, and where are you, Amy? Come on up, there you go. Let's give her a big round of applause. I appreciate her being here very much.
Thanks for having me here today. My name again is Amy Favre. I'm the Chief Communications Officer at Cover Oregon, and Rocky King, our CEO, sends his great regrets. As you can imagine, we have a lot going on this week and last week, and our staff are really working around the clock to get Cover Oregon up and fully running, as states are around the country. I was on a conference call last night at 9:30, and I took that from my house, but a number of folks on the call were still at the office working hard. So Cover Oregon, I think most of you are familiar with Cover Oregon, but just very briefly, Cover Oregon is Oregon's state-based exchange. We're an online marketplace for insurance where individuals, families, and small businesses with 50 and fewer employees can shop for insurance. They can browse a variety of plans. They can find out if they're eligible for financial savings to help them pay the cost of those premiums. They can also find out if they're eligible for the Oregon Health Plan or Healthy Kids, and they can choose the plan that's right for them and for their families. I think before we talk about sort of an update on where we are with Cover Oregon, it's important to step back and remember why we're doing all of this work. And I just wanted to tell you a quick story that happened to some of us at Cover Oregon last week. Last week, as you can imagine, was our first week. It was a very busy week, and many of us were at the office until pretty late each night. And several of us would go to dinner later in the evening at a restaurant near our office. And we were at the same restaurant for 3 nights in a row. And on the third night, the waitress said, "Cover Oregon. Y'all are Cover Oregon." And we stopped and we said, "Yeah." And over those previous 3 nights, she had been working and had overheard us talking. And she said that, you know, I went online. I went on coveroregon.com, and I looked around for a plan, and I found the plan that I want to buy, and I'm excited to buy it as soon as I can, because she is married and has a young child, and while her husband had insurance through his work, she was uninsured, and her child qualified for Healthy Kids, so her child was covered, but she was uninsured, a 26-year-old mother. And a year ago, she got in a car accident. And after that car accident, she was able to negotiate with the hospital that treated her and got herself down to a payment plan for $26,000. So at 26 years old, she had a $26,000 bill, medical bill, that she was slowly paying off. And she said, you know, I learned my lesson from that. I know the importance of having coverage, and I'm really excited to find out the tax credits that are available to me and to buy my plan. And that's really what this is all about. There's over 560,000 uninsured Oregonians, and we estimate that about 400,000 people, those are both uninsured and people who currently buy insurance for themselves, will be eligible for some form of a tax credit to help them pay for their premiums. The Affordable Care Act, when it passed in 2010, gave states a choice, as you all know. They said that states could either create their own state-based exchanges, or the federal government would come and run one for them. And Oregon was one of the very first states to pass legislation for a state-based exchange. And we've really taken that to heart, that we're trying to create a state-based marketplace that's for Oregonians and by Oregonians. We were created by an act of the legislature in 2011, and we were formed as a public corporation. So we're not part of state government, unlike some state exchanges. We are a public corporation like OHSU or SAFE or the Port of Portland. Quick timeline to keep in mind. There was a lot of national attention on October 1st. You know, October 1st was the big day that we were all going to go live. And it was a very important day in terms of bringing awareness to the open enrollment period that started that day. But the coverage that we're selling through coveroregon.com isn't effective until January 1st at the earliest. So people are buying plans today for coverage starting January 1st. And the message that we're trying to get out is that people have some time. As long as somebody buys their plan by December 15th, that coverage will be effective on January 1st. And that's surprising news to some people. We hear from folks that they're concerned that we might run out of slots. There might be a waiting list for financial savings or for the Oregon Health Plan. And none of those are true. Really, for the first time, anybody who's eligible for the Oregon Health Plan or for the tax credits to help them pay for insurance will get it regardless of how many people enroll. So there's no huge rush to coverage as long as people purchase their plans and enroll before December 15th. Our open enrollment period is for 6 months. It goes all the way until the end of March. We've been, as you can imagine, very busy. The first week, we had 249,000 unique visitors to CoverOregon.com. That was as of the end of the day on Monday. And our service center has fielded 8,400 calls in that first week. We have a very robust marketplace at CoverOregon.com. We have more participation from carriers in Oregon than in almost any other state. We have 11 insurance carriers participating in the individual market and 8 carriers participating in the small group market for small businesses, for a total of 102 plans in the individual market and 73 plans in the small group market. This is an amazing level of choice for consumers that most state-based exchanges aren't enjoying. So we've had incredible participation by carriers. They've shown incredible support and patience with us as we work through many of the technological challenges, and we're very grateful for their interest and participation in bringing this to all Oregonians. We've been working hard over the last several months to get the word out about what's coming, and we're continuing to do that now that we've gone live. We launched our ad campaign back in July, and I know in a breakout session later today, you'll have an opportunity to ask questions and hear more about what we're doing in marketing CoverOregon.com. We have trained and certified a network of really our boots on the ground people who can help individuals understand what's available to them through Cover Oregon and enroll in coverage. We know that buying health insurance is a major decision for many people, for many families, and not everyone is going to be comfortable going online and doing that all online. So we have a network of trained agents and community partners out there to help people. We've trained over 2,000 agents and over 1,700 individual community partners at over 100 organizations around the state to be that personal touch, to be that person that a consumer can sit down across the table from and get the help that they need to enroll in Cover Oregon. We've been doing presentations around the state. We did community meetings all around the state. We've been doing presentations wherever we're invited as often as we can to help get the word out. And we have created an array of materials, marketing materials, brochures, fact sheets that target different demographics that are available to anybody who would like to order them free of charge at our online store, which is CoverOregonStore.com. You can go online and browse what we have available and order what you think you need to help us get the word out. We've been focused a lot of work in reaching diverse populations. Not everybody can hear the same message in the same way and be expected to respond in the same way. We have translated many of our marketing materials and brochures into 7 different languages. We're right now about to launch a Spanish language ad campaign that will be in print and cable TV. Our community partners that we are funding to do work around the state to be that on-the-ground assistance that can reach specific, harder-to-reach communities, such as those in rural areas or folks who don't speak English. We funded outreach and enrollment grants so far to 31 organizations. We have another round of grants that are currently in deliberation. Those applications are being reviewed right now, and those will fund providers and also additional outreach grants for organizations. We'll be shortly announcing another round of grants that we are funding to help get the word out to small businesses. So we'll be funding some business associations to help us do that outreach, and we've also provided grant funds to tribes to help us get the word out to their members. As we've hit the go live button last week, we, as every other state that's running a state-based exchange, have been working very hard to make sure our technology works the way it's supposed to. In anticipation that there would be some challenges along the way, about 2 months ago, Cover Oregon made a decision, unlike any other state, to have a strategic launch plan. We said that from day one, we would have folks be able to get started enrolling in insurance by working with one of our trained and certified community partners and agents. Our public site, coveroregon.com, right now, anybody can go to. They can browse plans. They can put in particular aspects of their household information, their salary, the demographics of their family, and they can, it'll populate a list of plans that are available to them in their area of the state. And the prices of those plans will also give an estimated calculation of the financial savings available to that person, or whether or not they may qualify for the Oregon Health Plan or Healthy Kids. People can also go to coveroregon.com right now, and they can search for one of our trained community partners or agents who can help them get started. We are accepting paper applications at the moment as well at our service center and online. We launched in this way in particular because we knew that we would experience some bugs in our technology. You can't launch a technology system this large and this complex without having some issues once you go live, no matter how much testing you have done. In order to help us work out the kinks in the early stages and also make sure that the consumers themselves who are interfacing with coveroregon.com have the smoothest experience possible, we did what we called a soft launch. Sometimes it's called a beta launch. It's a standard practice in launching IT projects of this size. And the the analogy I like to give is with Google. I think many of you probably remember when Google first launched Gmail many years ago. You couldn't just decide to have a Gmail account. You had to be invited by somebody who already had a Gmail account in order to open one. And eventually that changed, and anybody who wanted a Gmail account could get a Gmail account. Google did that very deliberately so that they could control the initial pool of users, so that as they identified systems issues and bugs, they could resolve those without impacting the broader consumer base. And so that's what we have done as well. And we're happy we did that because, as you can imagine, and you've probably read in the paper, we have encountered some challenges that we're working very hard to work out right now. One other aspect of our going live that I wanted to mention was the Medicaid expansion. The Affordable Care Act increased the income cutoff for Medicaid to a level much higher than it had been in the past. Makes a lot more Oregonians eligible for the Oregon Health Plan. The Oregon Health Authority, which runs the Oregon Health Plan, has implemented a fast-track enrollment process, which is really going to help people get enrolled. Anybody who is food stamp eligible or SNAP eligible, Supplemental Nutrition Assistance Program eligible, they're automatically going through a determination process with them. And if they discover that they are eligible based on their income for the Oregon Health Plan, they're sending them a letter. And all the family has to do is sign that letter and return it, and they'll be automatically enrolled in the Oregon Health Plan, which is really great news for a lot of families. So I mentioned some of the challenges that we're having here as in our first week of being up and running. Our public site, the site where people can search and browse plans, experienced extremely high demand on the first day. We had over 130,000 visitors that first day, and at certain points in time we were getting 20 to 30,000 hits a minute. It overwhelmed our servers. We very quickly were able to add additional servers, so we never took the site down, but people who were on the first thing that morning did experience some slow response times in the searches that they were trying to do. But that was addressed early afternoon on October 1st, and since then we haven't had any troubles. We have had, we've been unhappy with our ability to determine eligibility for folks. So this is how we determined if somebody's eligible for the Oregon Health Plan or those tax credits to help them afford the insurance. Our system has been inconsistent in terms of correctly determining that eligibility. And that's something that about 2 days before our launch, we decided that we weren't happy with. We wanted to make sure we got it right rather than rushing to get it out. And so right now our community partners and agents can help people get started in the process, and they can get the process going by submitting an application either electronically or by fax. but we're not doing the instant eligibility determinations that we will be doing shortly. We know that these eligibility determinations are really critical to families. It's extremely important that we give them an accurate determination of whether they're eligible for Healthy Kids, Oregon Health Plan, or a tax credit subsidy and the size of that subsidy. And so until we're 100% comfortable with our determinations, we're going to hold back on that. We said on our press conference on day one that we anticipated we'd have that up and running by mid-October, and that is still our goal. So we still plan to have that up and running by mid-October, and we still plan to have the site open to all consumers for full functionality at the end of the month. None of this impacts our timeline in terms of the plans being effective on January 1st. Consumers have until December 15th, as I mentioned, to sign up for insurance that will be effective on January 1st. We have contingency plans in place, and if we continue to experience challenges with our technology, we have workarounds so that we can make sure that every Oregonian that wants to enroll through Cover Oregon can, so they can get an accurate eligibility determination and they can get the financial savings that they deserve. This is a look of what probably many of you have been on our homepage in the last week, coveroregon.com. This is what it looks like. This is where people can get started. They can search for those agents or community partners who can help them get the process rolling. If they want to wait and do everything themselves online, they can give us their email address and we'll send them a notice once we're fully up and running and they can get online and do that themselves. Or for those who want to just browse plans anonymously, see what might be available to them and the costs, they can do that. Here's just a look at what our search database looks like for finding one of our trained agents or community partners. People can search by zip code, they can search by language, so if they're looking for somebody who can help them or a family member in a language other than English, they can do a search here. And then they get the results listed. This is just an example of what it looks like. It would also have a link to all of their contact information. If somebody wants to browse plans, as I said, they can put in their family size, their income information, their age, whether or not they're a smoker, and up will pop the plans that are available in their area, as well as the prices. And these prices are prior to any subsidies, any tax credits that they might receive. On the left-hand side of the screen, you can see an estimate of their savings that they would have. And again, this is an estimate at this point, but it gives people a general idea. We've had pretty positive feedback in these first couple of days from some of the consumers who've pinged us on our social media sites. We have a man named Mark who said that he found out that he can cut his family premium in half using the tax credit and get a huge increase in coverage. That increases in coverage is due to the essential health benefits that the Affordable Care Act mandates. It's basically a floor under which no plan can fall anymore. All plans sold through Cover Oregon have to cover these essential health benefits, which include things like prescription drug coverage, hospitalizations, preventative care, maternity care, many things that people in the past often found out too late that their plans didn't cover. We are out there, we're on all of the social media networks. We have our call center, it's up and running at 855-COVER-OR. We encourage the public to let us know what they think. You can feel free to follow us if you aren't already, either on Facebook or Twitter, or if you go to our website and give us your email address, we'll keep you on our list to receive all of the notifications of what we are up to over time. And with that, I wanted to leave about 15 minutes for questions, and it looks like we have about that left. So there are a couple of microphones here in the room, and I'd be happy to take any questions that you all might have.
As people are coming, I just want to say, first, no tomatoes, which is great.
No tomatoes, not yet.
It is I think, a testament to how much everyone is sort of rooting for Cover Oregon, right? In other states, it's not that unequivocal, but it's pretty unequivocal in Oregon. As questions come from the audience, I want to ask you first a personal question. What is the stress like right now from a personal perspective, trying to get this live. And even once it's live, you'll still be working out the bugs. And how is that personally balanced by this tremendous historic period in which you're participating?
Yeah, that's a great question. It has been a tremendous task. You know, in some ways, October 1st coming and going was a relief because so much of what we have done for the last 2+ years is anticipation of that date, you know, and working on the technology, and in some cases speculating what might happen when we hit the go live button, and you know, and now we know, and now we can work on making it better. It has been a tremendous journey. I think it's been both very fulfilling and very emotional for a lot of people on our staff who've been with us from the beginning, some just for the last few months, but everybody really recognizing what a monumental time this is for our country and for our state. As you mentioned, we're incredibly fortunate in Oregon to have really broad-based support for what we're doing. The bill that created Cover Oregon passed the legislature with overwhelming bipartisan support from business, support from consumer advocates, and we felt that continue as we've moved forward. And I think, you know, we are grateful for people's patience as we work out some of the technology glitches, but also recognize that all of this hard work will eventually result in, you know, potentially 300,000 more Oregonians having access to affordable health insurance that they've never had access to. And we're hopeful that, you know, down the road, we'll be able to look back at this time of incredibly long days and a lot of stress and say, you know, because of this work that we did, these folks, like the fellow Mark, found he's going to have better coverage for about half the out-of-pocket cost.
Yeah. Great, great. Questions?
My mother-in-law will need help navigating this system to get coverage. She's currently uninsured. What will she need to do in order to authorize me to help her or act on her behalf?
Well, on CoverOregon.com, you can sit down with her and help her enter the information. You can also look online for one of our agents or community partners who can help both of you. In terms of legal transfers, I think that's a question best answered by our service center. If you call 855-COVER-OR, they can help you understand all of your options.
Okay, thank you.
Yes.
Good morning.
Good morning.
Is it on?
Yes.
Okay. I have two unrelated questions. The first one is about individuals and families who newly qualify for the Oregon Health Plan. Does Cover Oregon have any role in distribution or assignment of patients to a CCO?
So the CCOs that will be available for people who are eligible for the Oregon Health Plan, if there is more than one available in the part of the state where somebody lives, then those options will populate on the screen, much like the screenshot I showed you of the commercial plans, the private plans. There'll be options available and people can look at them and choose. When folks are eligible for the Oregon Health Plan, that same thing will happen. So the CCOs available in their area will populate the screen, and if there is a choice, then they can make that choice right then and there. So we don't have a role in which CCOs there are and how those are structured. We are the marketplace for people to know what their options are available.
So I'm wondering about funding for Cover Oregon. Mm-hmm. So I understand there was a federal grant that got you guys started for 2 years. Is that right?
That's right. We've had a series of federal grants. Like other state-based exchanges, we are 100% funded with federal grant dollars. We've had a series of different grants. The grant we are currently operating under was a 2-year grant. It was awarded early this year, and it takes us through the end of 2014, so through our first year of operations. And then after that time, we have to be, according to the Affordable Care Act and our state legislation, we have to be self-sustaining.
So that was my question, is how will Cover Oregon continue to provide this service? Or where will the money come from?
Sure. The state legislation that created Cover Oregon allowed for a funding mechanism to keep us self-sustaining over time, and that is an administrative fee charged to carriers on plans sold through Cover Oregon. So there's a fee that we set, and there's caps in place in statute that we can't go above, that are assessed on every plan sold through the exchange. That fee is not directly passed on to the consumer, so somebody who buys that plan doesn't see that fee added in. It's built into the administrative cost of the carriers and then spread throughout the pools. And that's the fund that will sustain us ongoing.
Thank you.
Good morning. I was wondering if you could elaborate on some of your contingency plans, because if a lot of people are like me, they're probably going to wait till the last second to get on Cover Oregon and enroll on December 14th or 15th. So I'm just kind of wondering what the plans are around the end of this period.
Sure. Well, our contingency plans are really focused for if we feel like we aren't going to have the technology in place up and running, and I would say that would be more like in November, that we need to start doing some manual workarounds, we would implement them. So we will make sure that we have, if we need them, manual workarounds in place so that nobody who waits till the last second will miss that opportunity. Now, we fully anticipate that we will have end-to-end functionality, so from start to finish, you'll be able to enroll in a plan in November, but we have the systems in place that if for some reason that's not there, then we will, behind the scenes, be screwing around, and doing things manually, but it won't affect the consumer's ability or your ability to enroll in coverage, even if you wait till that last day, because we anticipate that a lot of people will wait until that last day.
Thanks.
My name is Will Nettleton. I'm one of the family and preventive medicine residents at OHSU. And my question relates, I believe, to one of the breakout sessions that will be addressing this question. But I'm curious to hear your thoughts on what you believe the role of clinicians or others are in providing health services in getting people enrolled or plugged into health insurance exchanges.
Yeah, we are partnering very closely through our community partner network with providers, because so often it's the providers or those clinics that folks go to that where people appear for services and they're not insured, or their insurance isn't sufficient to cover their needs. So we are working with provider groups to help us enroll people who come to their offices. That was a model that worked incredibly well through Healthy Kids, the state's Medicaid program for children. When that rolled out in 2009, partnership with providers was really critical to identifying people who could benefit from this coverage. So we're continuing that both for the Medicaid expansion, Healthy Kids, and then some folks who are uninsured but perhaps don't income qualify for Medicaid, to help them get enrolled in coverage so that the next time they come for the visit, hopefully that they will have that coverage that they need.
Are there ways on the website to have those partners come to clinics or come to health facilities or to plug into that?
Yeah, I'd be happy to chat with you afterwards and help you get connected to our community partners who are doing outreach.
The eligibility for children for Healthy Kids has been raised to 300% of the federal poverty level. Many of these children in the pediatric offices have had commercial insurance, and now they will be looking at options with CCOs. How will Cover Oregon help them stay with their medical home and their PCP through that process so that they can make a choice, a wise choice when they have to select a CCO, so that they can keep that continuity of care? And how does that information get passed to the CCO so that immediately they're connected to the right provider?
So we will have an available search database once we're fully functional, so that people can go online and they can, I mentioned that there's 102 total plans in this universe, which is a lot for somebody to digest. And that's not available in every part of the state, but we'll have different search filters that people can use. So if their number one thing that's important to them is that their plan covers a certain provider, they can search for that provider by name and find out which plans cover that provider. They can also work with one of our trained agents or community partners if they need a little bit more of a hands-on touch.
A quick follow-up, is that also available on the OHP side of the portal?
So Cover Oregon is the public-facing site for both commercial plans and for the Oregon Health Plan. So the information that we have is the information we've worked with the Oregon Health Plan to populate.
One of the things I hear sort of in the buzz after the well, we all knew there was going to be glitches kind of comment, is at what point do we really need to worry? And I know that everything will be taken care of before that point, but for I'll pick on Alaska for a second just because I was just there last week and we just held this event there, and they have a much different perspective in terms of engagement and exchanges. And we don't know the number in Alaska of people who've gone to healthcare.gov, but according to Premera, which is the dominant plan there, about 70% of the market, I think, as of Friday morning, they had one applicant enroll. That won't be the number this next Friday morning, but there does need to be enough time to get a good critical mass of people who sort of buy in by applying and engaging. And if there's not enough time, particularly for the young immortals that wait to the last minute, and particularly within the context of all of this stuff that's happening in DC right now, at what point do we need to start worrying about the enrollment piece? Not necessarily the technology piece, that'll get figured out, but the enrollment piece. What are your thoughts there?
We anticipated from the beginning that we would get the bulk of our enrollments in November and December because of that December 15th, because most people who know about us now know that that coverage will be effective January 1, and they want it January 1. In order to be enrolled in a plan, though, you have to actually pay the first month's premium. And not that many people want to pay their premium in October if they don't have to pay it until December. So we knew all along, and most states are making these assumptions too, that we'd get the bulk of our enrollments in November and December in anticipation of that January 1st deadline. We will be, as I mentioned, we have our contingency plans in place if the technology isn't there. I believe the technology will be there in early November at the latest. But, we will be, I think our biggest challenge, to tell you the truth, is really to rebuild the buzz that October 1st had. We had 135,000 people come to our site on October 1st. And now, they're hearing about the challenges that exchanges are having. They're hearing about the efforts to shut down the government and defund the Affordable Care Act. And we then have a big job, once we're fully up and running, of letting people know we're fully up and running, come back. Yeah. And we will be launching the next phase of our marketing campaign toward the end of October, early November, to do just that. And so we need to rebuild that buzz, let people know we're here, we can help you fully enroll at this time, and get them back in so that everybody who wants to have that coverage start on January 1st can have it. Absolutely.
Let's give her another round of applause, please.
Thanks.
Thank you. Very well done.